Look at your teeth near the gums. See that small notch? What if I told you that groove might be a sign your nervous system is under constant stress? And if the pressure continues, that damage doesn't just stay the same. It slowly gets worse. And feelings alone won't fix it. Let me explain. First, let's understand what we're actually seeing. These are small grooves near the gum line. They're usually V-shaped or wedge-shaped, and they most often show up on premolars or canines, the teeth that take a lot of force when you bite. If you run your fingernail over one, it feels sharp, not smooth like normal enamel. And many people don't even notice them visually at first. They notice them because of symptoms. You drink something cold, and suddenly there's that sharp electric pain. You brush your teeth, and one specific spot feels extra sensitive. Food keeps getting stuck in that tiny groove. Now here's something important. Most of the time, these are not cavities. They're not caused by bacteria eating into your tooth. We call them non-carious cervical lesions. That just means tooth structure has been lost, but not because of decay. So if bacteria didn't cause this, what did? This is where people are usually surprised. These notches are rarely caused by just one thing. They're usually multifactorial, meaning several factors work together. But one of the biggest drivers is something many people don't even realize they're doing. Clenching, grinding, excessive bite force. Your teeth are not solid blocks of stone. When you bite down hard, they actually flex slightly. Under normal chewing, that's fine. But when the force is excessive, repetitive, or includes side-to-side grinding, that flex concentrates at the weakest part of the tooth. And that weakest point is right at the gum line, where the enamel ends and the root surface begins. Over time, repeated microscopic flexing creates tiny stress fractures in the enamel. Cracks you can't see, but month after month, year after year, those microcracks expand, and eventually a wedge-shaped defect forms. That's the notch. And once your enamel is gone, your body cannot grow it back. But here's something deeper. These notches are often a sign your nervous system is under tension. Clenching is rarely something you consciously choose to do. It's regulated by your central nervous system. It's strongly linked to stress, anxiety, and what we call sympathetic activation, your fight or flight response. Many people grind at night and have no idea. Many clench while working, studying, driving, or lifting heavy weights. Even I catch myself clenching when I'm hyper-focused, like during a difficult root canal. So you can't always just decide to stop, because often it's not voluntary. That's why this isn't just a tooth problem. It's often a stress physiology problem. Now let's talk about brushing, because this is the most common assumption. Aren't these notches just from brushing too hard? Brushing can absolutely make these lesions worse. If you use a hard toothbrush, scrub aggressively side to side, or use abrasive toothpaste, you can wear down areas that are already weakened. But brushing alone usually does not create those sharp, wedge-shaped defects. It accelerates them. It enlarges them. But in most cases, it's not the original trigger. And that matters because if we only blame brushing, we might completely miss the real cause. And then the problem keeps coming back. And there's another important factor. Acid. Frequent exposure to acidic drinks, soda, energy drinks, citrus juices, or even acid reflux can soften enamel. When enamel softens, it becomes more vulnerable to mechanical stress. Now combine softened enamel with clenching forces and aggressive brushing, and the damage accelerates. That's why this is rarely a single cause issue. It's usually a combination of mechanical stress, nervous system tension, acid exposure, and brushing habits. And if the cause is multifactorial, the solution can't be just one thing either. If the underlying force continues, the flexing continues. And if the flexing continues, the notch slowly deepens. At first, it might look cosmetic, but as the lesion grows, dentin becomes exposed. And dentin is softer than enamel, and it contains tiny tubules that lead toward the nerve. That's why cold air suddenly feels like electricity. As more structure is lost, sensitivity increases, the edges become sharper, and the tooth becomes mechanically weaker. This doesn't mean your tooth will suddenly break, but over time, if the cause isn't addressed, treatment can become more invasive, and that's what we want to avoid. So, can you stop it? Yes, But only if you treat the cause, not just the surface damage. If you only feel the notch and ignore the stress, the cycle continues. So how to stop progression? First, reduce mechanical stress. Your teeth should not be touching at rest. Remember this: lips together, teeth apart, tongue resting gently on the palate. If your teeth are touching during the day, you're likely clenching. Check yourself while working at a computer, driving, studying, or training at the gym. Awareness alone can significantly reduce cumulative force. Second, night guard. If you grind at night, and many people do, a custom-made night guard redistributes bite forces and protects your teeth. It won't reverse existing damage, but it can stop progression. Over-the-counter night guards can help too, but custom-made guards are more precise and better balanced. If you're serious about protecting your teeth, custom is a better option. Third, manage your stress. If your nervous system is constantly activated, your jaw muscles will stay activated too. Improve sleep, reduce excessive caffeine, exercise regularly, and practice breathing or relaxation techniques. These are not just soft solutions. They directly influence muscle tension. You can also try gentle masseter massage, temporalis massage, heat therapy, or TMD physiotherapy. These can reduce muscle tightness, but they do not reverse lost tooth structure. What about fillings? Well, composite fillings can improve appearance, reduce sensitivity, and protect exposed dentin, but they do not make the tooth structurally stronger in this situation. They cover the defect, but they don't eliminate the force. If clenching continues, the filling may debond, margins may open, and sensitivity may return. That's why treating the cause first is critical, then restore if necessary. Crowns are a more invasive option, and they require significant tooth preparation. They are reserved for severe cases, not small early lesions. Conservative first, invasive only if needed. Desensitizing options like fluoride varnish, potassium nitrate toothpaste, or sealants can help manage symptoms, but again, they don't eliminate stress forces. If you're noticing your teeth look longer or your gums are receding, you need to understand what's happening underneath. Watch this next video, because treating gum recession the wrong way can make it worse. And I'll see you there.